I was having trouble getting my snow boots on that morning because I had gained quite a bit of weight from prednisone from another illness I had. So it was just, I was taking care of my mother who was sick, and she was pretty demanding, and I was pretty stressed out, so I'd get pains once in a while in my chest, and I just thought anxiety and from my mom and from overwork and being on the road all the time.
I think the story that she told was very interesting because she had this group of symptoms that I think a lot of people will just sort of ignore. And it was really the gals that were working in radiology here that sort of picked up and noted how short of breath she was when she came in for this x-ray procedure. And they were the ones that essentially probably, to some extent or another, saved her life because they made her see Dr. Weedle in the emergency room, and then he subsequently transferred her to me.
That was not what I wanted to hear. I was too busy to have heart problems. It never entered my mind that that's what was going on, ever. Oh yeah, tiredness, little pains, aches and pains where I work and what I do. I have pains all the time, shooting up my arms or somewhere, you know, so it wasn't out of the ordinary that I wasn't feeling that crick up my back or that pain in my chest or a little bit of stab, and it was there for a few seconds and then it would probably go away, and I never ever dreamt there was something wrong with my heart.
But the symptoms, prior to her coming for that x-ray, a lot of aches and pains and some shortness of breath, fatigue and weakness, pretty non-specific symptoms overall. Not a lot in the way of typical chest pain, however.
I couldn't even mop the floor or sweep the floor without being just, just sweating. I would have to sit down. Oh, it had been going on for a while. I was missing quite a lot. Like I said, I thought it was just anxiety with my mom, and my blood pressure was sky high. And I would mention that to several people, and it's like, don't worry about it, you're reading too much into it, it's fine. So it had been going on.
She was having a lot more the neck pain, the shoulder pain, the back pain. And again, you don't typically associate that as much with heart disease in men or women as far as that goes, but with women it seems to be a little bit more common, that we see. You think of just pure shortness of breath. Why all of a sudden, you're 40 or 50 or 60, all of a sudden you start to notice that your exercise tolerance is dropping, that your breathing is getting worse, and maybe you're even getting so bad that even to lay down with a pillow at night becomes difficult and you have to sleep up in a chair. Those are sentinel symptoms of you should go to your doctor soon, because that's your heart more than likely. It's not your lungs, it's not a cold or the flu, it's your heart.
When I think about those symptoms that I was having, they were so small, and I just never read that much or studied that much about heart conditions, so I wasn't that much aware. My dad had died of a heart attack. I was aware of those symptoms, but it just didn't click into my mind that might be going on with me. And they suggested I have something else looked at, which was my heart. They thought I was having a heart attack. And I'm like, no, I can't have a heart attack because I'm way too busy for that.
That's pretty classical for women in the sense that they do not present the same way that men do. And so when she got to x-ray though, the techs noted that she was quite short of breath, even just getting up on the table or doing anything minimal. And so when she told me those symptoms, I was very suspicious that she had a problem, as was Dr. Weedle before me. And I think that, the good news is she hadn't waited long enough where she damaged her heart or anything. And the good news is that it was really, really important for events to transpire like they did, because she had a very bad blockage in a very, very critical area, and had it not been treated soon, she could have easily succumbed to that. I placed a stent, just one stent, but again in a very critical spot in the front of her heart, and an area that, ironically we call the widowmaker. And so it was really important that again, that all those events transpired as they did.
Well, I think I owe them my life. It was a miracle that day that Donna and Deb sent me over to see somebody else to have my heart checked out. So I figured I was given a second chance.
I think, again, mom or daughter or wife isn't supposed to ever have heart problems. And so it gets sort of swept under the rug, and it's due to other things. I see one of the things that frustrates me, and I knew about it when I was a medical student or a resident, is I think a lot of young women, especially young and maybe some middle-aged women, come in and maybe there's like an aura of that it's in their head, or that it's psychosomatic, or that they're crazy, or on, and you don't get that, I don't think, quite as much with guys. I might be a little biased there, but I see that a lot, and then I go on to investigate that patient and find out they have significant heart disease. I mean, I have quite a few patients like that, in fact.
I am very fortunate, thanks to those two women, because I'd have just kept going and just thinking it was the stress from my mother taking care of her. I didn't have time for heart problems.
Well, I think it's important that we, get ahead of this. Women are now the majority in this country, and they do present with heart disease. They do have heart attacks. Even 20-year-old women have heart attacks. And how we manage those patients compared to how do we manage a young male can be very, very different. So my advice is that, you always discuss this with your primary care provider, be it a nurse practitioner, PA, or your physician. And I think that, that is such a critical time that, especially if you're young or middle-aged, I think that if you don't feel like they're listening to you, or you don't feel like they're, giving it enough credence, or however you want to put it, then it's always worthwhile getting another opinion,
Now that I'm all fixed up and have a second chance, I believe I'm going to retire now the 1st of November. So I'm looking forward to that. My advice to other women is to go get checked out. No matter how small you think it is, it could be a big deal.